Yeah.
Yeah. This is like tea time. It's like coffee clutch.
Clatch or clutch?
I'm not sure.
All right, Breast Cancer Awareness Month. I want to tell you 3 quick things about breast care.
Okay.
One is that it doesn't matter if nobody in your family had breast cancer or if everybody in your family had breast cancer. Basically, being a woman who has breasts puts you at risk for breast cancer because it's such a common disease, and even men are at risk, but not very high. A very small percentage of breast cancers are in men. So one is to be aware that that's something that you're at risk for, and there's some easy schmeezy things to do that greatly reduce your risk of breast cancer affecting your life adversely. So number 2 is if we detect breast cancer early, it's pretty easy to treat it without disfiguring the breast. And along those lines is to always go to a breast surgeon or a breast center that is on board with doing a high number of nipple-sparing mastectomies. The vast majority of breast cancers can be treated with nipple-sparing mastectomy so that the shape and the size of the breast is natural, and that there aren't a lot of very unsightly scars and patchwork appearance and distorted shape as a result of the breast cancer surgery. So you want to ask, well, do you all do nipple-sparing mastectomy? Oh yes, we do them in certain cases where it's indicated. Well, what percentage of your mastectomies do you do with nipple-sparing mastectomy? I think that nipple-sparing mastectomy is really the standard, and a woman can have a nipple-sparing mastectomy, have her cancer treated very effectively and equally as effectively as any other method, and still have a natural appearance of her breast and not be disfigured for the rest of her life. Okay, number three. Just to review, 1, breast cancer is common.
Yes.
2, don't worry, catch it early because you can have a natural breast, natural appearance, non-disfigured, whether you're younger or you're older. You don't have to live the rest of your life with a disfigured breast just because you had breast cancer. It can be treated very effectively surgically if you go somewhere where nipple-sparing mastectomy and other oncoplastic methods are accepted and done commonly. And third, I just want to review real quick with you a breast self-exam because it's one of the best ways that women can pick up a lump in her own breast, or even a man can pick up a lump in a woman's breast, his girlfriend or spouse. So, and I have had many men pick up breast cancer. So for the men watching, this is not, shouldn't fall on deaf ears. So the easiest way is when there's some lotion or you're in the shower and the breast is lathered up, because it's hard to feel the skin if there's not something oily to allow you to rub your hand over. In fact, there are some products that are made out of this kind of material, silicone, so that allows you to feel the tissue underneath. Basically, like using this soft model, you're trying to feel a little pea, and it's painless typically, but just a little lump, like a little jelly bean or a little pea in there that persists, doesn't go away. And even if it's not growing, if it's a persistent, discrete mass, not just lumpy material, but discrete mass, that's something that needs to be professionally evaluated. And just like when you're flossing your teeth or you're brushing your teeth, you want to go in an orderly way. So it doesn't really matter if you go up and down, around, or whatever. But you basically want to, at some point, feel all the areas of the breast, all 4 sides, and then the central breast and right under the nipple. So those 5 areas, basically up, down, right, left, and under the nipple. And you want to do it with something that either soap or lotion on the skin that allows you to rub your hand across and really feel carefully with the fingertips. So breast self-exam, you can get started on that one. And I hope that you have a great breast self-awareness month, breast cancer self-awareness month in October. And you I hope you have it too. You're gonna fly now.
Hold on, don't move. I don't know where it went, but it was like flying
Okay.
around your
All right.
face.